I'm Dr. Rizwan Tariq. I'm a medical oncologist and I work at Covenant Health. I'm originally from Pakistan. I did my medical school in King Edward Medical University in Pakistan. That's one of the top medical schools in the country. I started my residency in Pennsylvania in 2010, after which I moved to Florida, Orlando, University of Florida for my medical oncology fellowship. And subsequently, I went back to Pennsylvania for the past 7 odd years as a medical oncologist and recently started with Covenant Health. As a child, I always looked up to my father, and even at a very young age, I knew I wanted to be a physician. My first encounter with on the world of oncology was when my mother was diagnosed with breast cancer in my second year of medical school. I helped her through that process, and that was my first interaction with medical oncologists and chemotherapy and the side effects and how the patients are at the receiving end of it. That kind of opened a whole different perspective to things for me. I didn't think that I would be a medical oncologist at the time, but when I started my residency and I started to actually take care of patients with cancer diagnosis, I felt that my history with taking care of my mother translated into a positive experience with the patient. I was able to relate better with them, and I felt that I was at home when I was taking care of those patients. Any patient that is diagnosed with cancer, obviously, that's whether it's an early stage or an advanced stage, is always a devastating news. And when they come in to see their doctor, they want to know what exactly is going on with them. They want clear understanding of what they are dealing with, what the treatment is involved, but they also want the doctor to understand what their particular dynamics are. So anytime I'm devising a plan for my patients, I have to take into consideration the biology of the disease, the stage of the disease, what the genetic makeup of the cancer is, but also equally importantly, what my patient is, who their background is, what are their limitations, what would work for them and what would not work for them, and taking all that into consideration to come up with a treatment plan that they're happy with. I try my best that at the end of the visit, the patient leaves with a clear direction of what we're doing next, and they're optimistic about their treatment. So medical oncology is certainly a very exciting field. For the past few years, there have been a number of major breakthroughs, a lot of new treatments that have changed the outlook for many cancers, particularly targeted treatments looking at individual genetic mutations that are driving cancer growth. Also, immunotherapy has been a big game changer. Trying to harness the power of our own immune system to get rid of cancer has resulted in cure for cancers that were previously not curable. People who had a very poor outlook now have a much longer life expectancy based on using these treatments. And there have been a lot of major breakthroughs in using, again, our immune system for attacking cancer. That certainly is of a lot of interest to me. We are obviously looking to try to see if we can open clinical trials and research at Covenant to also further enable our patients to receive the best treatment possible. For me, the most rewarding part of my job is the connection with my patient and the ability to take care of them. I think that ultimately, obviously, we try our best to get the best possible outcome, but in world of oncology, that's not always possible. I think that the journey is as important as the destination, and being part of that journey with the patient, being involved with them, with their family, is probably more important, if not as important as the treatment itself. And I think that part is the most rewarding part for me, because ultimately, no matter what the outcome is, if I've done my part and have been there for the patient, then the patient and the family are very appreciative of it. And that for me is the most rewarding thing. I have a young family. I have 3 kids, and, I definitely love spending time with my family. I play pickleball, and that is in competition with my family time. So that's always fun. But I also enjoy photography, particularly landscape and hiking, and those are some of the other things I enjoy.